All right. Let me know if it's not working. Well, hi, everyone. Great to see you. Welcome to today's webinar. I'm going to be talking about youth substance use, why teens are using, how to prevent and intervene. I'm going to focus predominantly on nicotine, tobacco products, e-cigarette products, cannabis products, and a little bit on fentanyl. But our curriculums really cover all drugs. I am a developmental psychologist by training, an additional training in adolescent and young adult health. And myself and my lab focus on adolescent health-related decision-making, largely around drug use. So just a couple of quick disclosures that I'm required to give. First of all, I am an expert scientist in some litigation against the e-cigarette companies. Probably figure out which ones I've predominantly been involved in. And then I have also been an expert for city, state, and federal level policies around drug use. So today we're going to talk about, and hoping that at the end you'll be able to understand and recognize the different kinds of drugs, again, particularly tobacco, nicotine, and cannabis drugs that young people might be using. I want you to really understand the health harms associated with these drugs and why teens are using them, and then finish with some resources that you can use. As Haley said, please put in the chat, or excuse me, in the Q&A, any questions you have. I'm pretty good at looking as I talk, but if not, I will definitely get to them at the end. I also have a couple times where I give a little pop quiz if you want to play along and answer some of those questions. All right, so let's talk about the different tobacco products. Sorry, there's a question in the chat that I can't answer. Sorry. So different tobacco products. So as you may be aware, and if you've seen these with young people, the e-cigarette field has just exploded. E-cigarettes, electronic cigarettes, came on the market in 2007 into the United States. They originally came from China, but now we have American-made Chinese imports all over, different manufacturers bringing in electronic cigarettes. They've really changed over the years from a simple device that looked a lot like a cigarette all the way up now to all kinds of devices, and you can see them here. And I'm going to show you a lot of different pictures throughout, because I want you as parents or health educators, whomever is joining us today, to feel really comfortable in knowing what these look like and to be able to spot them should you find them either in your teenagers' hands, in their backpacks, their rooms, and so on. So we will definitely talk more about these. I do want to mention now, most of these devices that I showed here have nicotine in there, but we will talk about cannabis or THC, e-cigarettes. We'll also talk about others. By the way, you'll also hear I'm mostly going to say e-cigarettes or electronic cigarettes. I don't really call these vapes or vaping devices. I do when I talk to teens, but not when I'm talking to adults or fellow scientists. Why? They're not vapes. Vape is that vaporizer. It's when you make tea or when you boil hot water, that steam, that vapor that comes out. These are aerosols. These have aerosolized chemicals, and I'll show you the chemicals in a little bit. So the tobacco industry came up with the term vapes, so that way teens don't think that they're cigarettes, but they really are a form of e-cigarettes or cigarettes, and I'll show you more about that. All right, but I do want you to know about non-nicotine e-cigarettes. If you didn't know, you can actually vape your caffeine, melatonin, vitamins, and so on. And these, we did a study, and by the way, any of the studies that I'm mentioning at the end, I will give you my email. You are welcome to email me, and I will get you papers that support what I'm talking about. But these non-nicotine e-cigarettes that have other ingredients in there are also harmful. And you get a lot of young people say, I'm just vaping essential oils, or I'm just vaping flavors. Well, even if there's no THC and even if there's no nicotine in these vaping devices, e-cigarette devices, they are harmful. And we're worried. We did a study that showed that about 20% of teens, 15 to 20% of teens and more adults are using these non-nicotine e-cigarette products, and we're concerned. And I'll talk more about, when I talk about the ingredients in e-cigarettes, I'll talk why I'm concerned. The other reason why I'm concerned, by the way, is young people often start with these non-nicotine products and then move to using nicotine or THC. We also know that there are other kinds of nicotine products that have been very popular that we would call oral nicotine products. You may have heard of pouches that you're seeing on the top left, Zyn. Zyn is a very popular, newer, not new, but newer form of pouch that young people put. It's basically nicotine and other chemicals. They put it in between their lip and their cheek or their gum line and just maintain it there, and then they absorb the nicotine and other chemicals. They're not safe. Now, relative to other products, sure, they might be safer because you're not inhaling them, but they are not safe, and there's a tremendous amount of nicotine. I can show you more about this a little bit later. Teens are also using tablets or lozenges that have a tremendous amount of nicotine, Lucy gum, and then toothpicks. Yes, nicotine toothpicks. So I just want to point these out to you. Now, teenagers are typically using these as starter products. They're not using them to switch or try to quit smoking or e-cigarette use. They're really using them as a starter product, and that's where I'm concerned. So let's talk about cannabis products. So we'll go through these kind of quickly, but there are different cannabis products that are on the market, and I want to make sure that you're aware of them. So first of all, we have your traditional smoked or inhaled burned cannabis products. These are your joints, blunts, spliffs. Joint is your cannabis flower that's in a thin paper that's typically made for rolling cigarettes. Blunts are very common and very common with young people. Blunts are cannabis flower that's inside a cigar tobacco leaf. So either you buy the cigars and pull out the tobacco and put in the cannabis flower, or you can buy the cigar wrapper by itself and then roll the flower in there, the THC flower. Now, nowadays you can buy non-nicotine cigar leaves, but most teens are not using non-nicotine. So what's the reason why I pause here is with blunts, you're getting a combination of nicotine and THC, so both addictive properties, both sets of chemicals, and you're more likely to get kind of that double whammy of effects, which is why, and most young people don't actually realize that blunts have nicotine in there. Then you've got your spliffs, which are part tobacco, part cannabis, the last picture on your left. So for anything that you inhale, it generally takes about 5 to 10 seconds to feel the effects. The high lasts about 30 minutes to several hours. The high really depends on your body size, your body type, whether or not you've eaten, your metabolism, how quickly you absorb and clear the THC that's in your body, and so on. And then the THC concentration just depends on the THC concentration that's in the cannabis flower. And we'll talk more about THC soon. So you also see pipes and bongs. Teens aren't using these as often. The most common form of THC use amongst teenagers are joints, blunts, and then edibles, which I'll show you soon, and smoked, vaped e-cigarettes. But pipes and bongs, you can see there, are still something that is used by young people. Now, dabbing. Dabbing is another piece that I always like to pause on and make sure that people know. So dabbing is very concerning to me. It is highly concentrated THC wax that is heated, and then the aerosol is inhaled. You can see on the left an example. And similar to any other inhaled, 5 to 10 seconds to feel the effects. Effects last about 30 minutes to several hours. The reason why I'm concerned about dabbing is dabbing has 80% THC concentration, whereas the other products have around 20% THC. So dabbing is highly concentrated THC levels, and it is one of the products that's most likely to land young people in the emergency room because they have had too much. Now, they're not going to die from it unless they're driving and crashing or something like that, but very high potency and can be very, very harmful to young people. And then I mentioned that you can aerosolize or vape your cannabis as well. Absolutely, you can add into your e-cigarette either in a wax or an oil. The THC concentration depends on the oil and the liquid that you added in there. And young people anybody can either buy a THC cannabis-specific aerosolizing device. We've had volcanoes of these devices on the market for years, even before nicotine e-cigarettes became popular. But a lot of young people are also taking their nicotine e-cigarette, their Juul, their Puff Bar, or Puff Bar isn't cannabis, excuse me, nicotine anymore, but their what Flume, whatever product they're using, use about half of it and then open it up, which you're not supposed to do, but they open it up and then add in the cannabis wax. And one young person told me, yeah, and that way I get a double whammy of both the vaped cannabis and the vape nicotine, and young people like that. So it's something that we need to be aware of and talk to teens. The other thing that I hopefully have made clear is when you're talking about vaping or aerosolizing or e-cigarettes, you can have nicotine, you can have THC, and you can have caffeine or some other ingredient in there. So it's really important when if you find a young person using these products, that you ask them, what are you using? What is in there? Or have a conversation about that. And we'll talk about that more. But you can't just make an assumption about what is in their product. And it's very difficult to tell the difference between these different e-cigarettes and what's in them. And that's one of the problems with these products. All right, edibles. So the other THC product I want you to be aware of and young people really like are edibles. Is your standard cannabis infused food and drink. So your brownies and your cookies and so on. We've had these around forever. The reason why I'm concerned about these is twofold. First of all, unlike the inhaled that you'll feel the effect in a few seconds, edibles don't just go when you inhale, goes through into your lungs, bloodstream, into your brain fairly quickly. But with edibles, it actually is getting absorbed by the gut, right? It's going through a longer absorption process. So you may not feel the effects of an edible for 20 minutes or a couple of hours. The problem is that a lot of times, especially if you're somebody who's used cannabis before and you're used to feeling the effects right away, if you don't feel the effects, you might say, oh, I didn't take enough. Oh, I didn't take enough. And then you keep using more and more. The problem is by the time you feel the effect, 20 minutes or a couple of hours later, you are in a sense having had too much. So it's very easy to overconsume. The other problem is, and in your state it's legalized, in my state recreational is legalized as well. But even with legalization of these products, and especially if somebody's making this at home, you don't have good regulation. So the THC concentration might be dispersed throughout the product, throughout the cookies or the brownies or the drinks unevenly. So think about chocolate chip cookies. You're making cookies, you add in chocolate chips. One cookie might have 5 chips, another one might have 20. It's really hard to make it uniform. And that is the problem. And so we've seen a lot of young people wind up in the emergency room because of the fact that they're using edibles and didn't realize how potent they were. So we also see a lot of co-use of cannabis and tobacco. And I alluded to this, but let me tell you what I mean. So co-use can be different things. One is co-use of tobacco and cannabis at the same time. So in the form of a blunt or a spliff, as I mentioned. But you can also be using cannabis and tobacco within a short period of time, such as I finished my e-cigarette, nicotine, and then I hit a joint. Or I have a joint and then I hit a nicotine e-cigarette, or I smoke both within a few minutes of each other. That is called chasing, and young people like to do that because they're increasing the high, or anybody, not just young people, increasing the high by using both within a short period of time. Co-use can also mean that young people or anybody's just using them both within the same month or within the same period of time. So they may not be using them both within a few minutes, but a young person who is a user of both kinds of products. And that is very common. And in fact, some of the studies that we've done and published on and others show that co-use is highly prevalent and arguably more prevalent than young people who are using just one product or another. So 5 to 30% of adolescents have co-used. And in some of the studies we've published, the majority of young people who have used tobacco have also used cannabis. Typically, you're using tobacco first, then moving over to cannabis within a year or two. All right. So let's talk about what is in these various products. So I'm going to kind of go back and forth between nicotine e-cigarettes and cannabis. We'll talk about both. But if you're asking about the chemicals that are in e-cigarettes, now when I'm talking about e-cigarettes, I'm talking about both the chemicals that's in the e-cigarette, the actual device, as well as that plume of aerosol, plume of smoke, air, that's really an aerosol, as I mentioned, that comes out of these products. Now, earlier, if you recall, I said that cigarettes and e-cigarettes aren't that different in some ways. So cigarettes have thousands of chemicals. E-cigarettes have hundreds of chemicals, but they're not that different in a lot of ways. I've been doing tobacco research and tobacco control for about 30 years now. I used to have slides like this. Well, they weren't PowerPoints, they were actual slides, actual printed slides, but the same idea. I was talking about tobacco, cigarette ingredients for years. Excuse me, and things like lead and calcium, cadmium and chromium and benzene, and a lot of these arsenic have been in cigarettes as well for a really long time. So not that different. Things like formaldehyde, for example, and then nicotine obviously is in these products. E-cigarettes are more likely to have flavors and flavorants, and we'll talk about that in a few minutes, but they also have propylene glycol, glycerin, and other substances that allow the product to basically go from the device into your mouth and move through the body. Now, I was mentioning the non-nicotine, non-THC e-cigarettes. So e-cigarettes that have caffeine or have melatonin or vitamin B, vitamins, and so on. The problem with those is even if there's no nicotine or THC, they probably have flavors, and flavors themselves are harmful to inhale, or they have propylene glycol or glycerin, or in the case of THC, you may have heard, and we'll talk about this a little bit more, that they also might have vitamin E acetate, an oily substance that allows it to bind and go through the lungs into your brain. And that oily substance gets clogged in your lungs, and why we've seen so much lung injury and lung disease, particularly from THC e-cigarettes. So these products are not safe. Now, when we're talking to teens directly, and we've got mostly parents here, I believe, I want to make sure that you have some ways to talk to teens. Now, you certainly can show them this slide, but we also talk to them by saying, do you realize what you're putting in your mouth are similar to the following products? They're not exact, but it's the idea. So lead, you're not putting a car battery, but hey, lead's in car batteries. Are we worried about that? Do you really want to be inhaling a car battery? Or nickel that can be in cheap jewelry, or toluene that is in a paint thinner, or benzene that is in gasoline, or I can't even pronounce that easily, but pesticides that are in there, cadmium that's in other forms of batteries, formaldehyde. I love pausing and say to the class, how many of you have had biology where you dissected a frog? And most students will say yes. And you say, did it smell good? No, it smelled awful. Well, that's formaldehyde. Yeah, we knew it was formaldehyde. Well, do you know that that's in your vape? That's the way I talk to them. So that way they understand this. There's like diacetyl, that's a buttery flavor that can be harmful to your lungs. And of course, there's nicotine that is typically derived from the tobacco plant, although sometimes it is now synthetic nicotine, but that is in there. And all of these e-cigarettes also contain ultrafine particles and heavy metals, very, very, very small plastics and metals and volatile organic chemicals that you're inhaling and could be lodged in your lungs and harmful to your lungs. And then this is a picture of an e-cigarette product that was confiscated from a school here in the Bay Area. And the reason I want to show it to you is these products leak, or they can leak. And this here is some of the oily substances, and probably the yellow is probably benzoic acid that is leaching out up here of these products. And there are environmental harms. That's a whole nother talk, but environmental harms of e-cigarettes. If you touch it, you could absorb some of this that we worry about with the nicotine that's in there. We just don't know enough about this yet because they haven't been around as long as the research would want us to have them around, but this is concerning. So I also want to talk about the amount of nicotine that's in an e-cigarette. We call this our SIGs in an e-cigarette. And we have these slides available on our website, and you're welcome to use them and put around your classrooms or offices or whatever you want. So as you may know, a pack of cigarettes has 20 cigarettes in it. Anybody want to put in the chat how, and it's a trick question, you're not going to get it from the slide. If you were, how much nicotine is in one cigarette? Not how much do you breathe in, but how much nicotine is in one cigarette? Anybody want to play along and put that in the chat? I'll give you a minute. Or into the, sorry, I don't think you put in the chat, into the Q&A. Oh, I don't see the Q&A. Oh, maybe we don't have that enabled yet. Oh, there it is, sorry. All right, I'm getting people, there we go. 22 milligrams in one cigarette. 12 milligrams. One cigarette equals 1 milligram. Anyone else? About 1 milligram. 5. All right, so I will give you the answer. It is about 8. So one cigarette has about 8 milligrams of nicotine. However, and this was the trick, however, what you yield, what you actually inhale, is closer to about 1 or 1.5 milligrams of nicotine. So even though cigarettes are still the most effective way to be able to inhale nicotine, you still don't get all of the nicotine into your body and all the chemicals. So the point is, a pack of cigarettes has 20 cigarettes. If you were to inhale an entire pack of cigarettes, you would get somewhere around 22 milligrams, 25 milligrams of nicotine in an entire pack of cigarettes. Now, Juul, which I know is not used as much, although teens are still using, but I put this in here for just comparison because most of us are familiar with Juul. Juul it's a 59 milligram. We're going to do a little math, a little science, a little chemistry for a few minutes. Let's do the math for a second. So Juul pod is a 59 milligrams per milliliter volume pod. So that's the volume that's in there. If you take 59 milligrams times 0.7, you get about 41 milligrams. Juul would say that the majority of the nicotine that's in there, you get into your body. So basically, if you're inhaling an entire Juul pod, you're going to get somewhere around 30 to 40 cigarettes worth of nicotine. So some people will say 1 pack, some people say 2 packs of cigarettes worth of nicotine. I'll give you about 1.5. Now, Vuse and Elf Bar, which Elf Bar now has changed their name, they're always changing their name, but these have a lot more volume. So if you were to inhale an entire Vuse pod, you'd get about 80 cigarettes worth of nicotine. And Elf Bar is much, much bigger, much more volume. You'd get almost 600 milligrams of, 600 cigarettes worth of nicotine, a huge amount of nicotine. Now, you might be asking, well, but how much nicotine or how many pods does one person use? So we don't have a lot of information on the newer products, but Juul, for example, it's funny to say newer, none of these have been on the market that long. But Juul, for example, when we published a study and teens said that they were using anywhere from a pod a week, which is equivalent to about 2 or 3 cigarettes a day, to a pod a day, to those who were really addicted, to 4 pods a day. 4 pods a day is 1 to 4 to 8 packs of cigarettes a day that a young person is inhaling. Now, when you're talking about some of the other products I've asked, and teens are saying anywhere from 1 a day to 1 a week to 1 every month. So point is, these young people are getting a huge amount of nicotine into their bodies right now, arguably more than what we've ever seen with cigarettes. All right, let's now talk about, the newer e-cigarette products that are on the market, and what they have. So not only do they have a huge amount of nicotine, now we're going to do a little chemistry, but they have a salt-based nicotine. And this is the other problem. So if you've ever smoked or used e-cigarettes, which I've not, but in talking to a lot of people and based on the science, the older e-cigarettes prior to Juul, as well as cigarettes, use a free-based form of nicotine. Freebase, think about the litmus test, if you remember that in chemistry class. Freebase nicotine is very caustic. It has throat hit. People would talk about it. It doesn't feel good, makes you cough. That's because on the litmus test, it's very much on the basic side, the base, right? So it's very alkalinic, very caustic. What Juul did when they put their product, Juul came out in 2015, is they patented a salt-based nicotine. This means that instead of having ammonia and sugars to bind to the product and bring it through the body, the salt-based nicotine now adds salt in the form of a benzoic acid, and that moves the product more towards acidic, but really more towards neutral. So now when you breathe it in, it's smooth, it tastes good, it's not as caustic. We'll talk about flavors in a few minutes, but when it comes to the caustic component of it, that's really important. Now, the majority of teenagers and young adults are starting with e-cigarettes, at least they were. Some changes where now we're maybe seeing them start with Zyn, but the majority are starting with e-cigarettes. If you are a nicotine naive young person, you've not had cigarettes before, you've not had old e-cigarettes, you don't want that caustic feeling. You don't like that. That tastes bad, it feels bad, it makes you cough, it's uncomfortable. So using these salt-based nicotine, you inhale it and go, ooh, that's smooth, that tastes good, and I really like it. So Juul really revolutionized the e-cigarette market because of these salt-based nicotine products. Plus, it is easier to inhale, and young people are using, this is the first product young people have been able to use pretty much 24/7. They keep it under their pillow or near their bed in the middle of the night. I pick up my cell phone in the middle of the night if I can't sleep, check my email, bad hygiene for sleep. I know that, but I do. Young people are waking up in the middle of the night and they're taking a hit off of these products, and it's smooth and they can take in a lot of that nicotine. All right, let's talk about THC. So I mentioned that the amount of THC, which is the psychoactive ingredient in cannabis, has really increased over time, and it has. In 1995, according to the Drug Enforcement Administration, we were looking at 3 to 5% THC concentration. We're now upwards of 15%. And I mentioned earlier, dabbing can be 80%. So a huge, huge jump in just the THC potency that we're seeing. And there have been a lot of campaigns, I know here in California, where we're trying to reduce the amount of THC that's in these products. And just again, another view of how much THC has gone up over the last couple of decades. I often use the idea of right now, if you were to smoke one joint, THC cannabis joint, it's equivalent to about 10 joints when I was a kid. So it is so much more potent. And when a young person says, hey, mom, hey, dad, hey, grandma, you guys were using, or your friends were using, it's not the same product right now. All right, so let's talk about health effects, given all the information that I've just given you. All right, the body on cannabis and tobacco. Oops, missing a thing there, an arrow. So first of all, cannabis and tobacco have tobacco has nicotine, cannabis has THC. They alter and change your brain. They can change it in many ways. And also, you're more likely to develop anxiety and paranoia and slow reactions and poor memory, particularly from cannabis, not so much from tobacco, but anxiety, yes, and depression and other mental health issues with tobacco as well. But these products actually change the brain chemistry. Brains continue to develop until about age 25, and during the developmental stage, we're so much less likely to become addicted because your brain's still changing, and you introduce a drug like THC or nicotine, and it actually changes and permanently changes your brain structure. These products can also change your heart rate. Cannabis in particular changes your muscle coordination and balance. Both drugs can have effects on lungs. We'll talk about more. And then we'll talk a little bit more about cannabis, how it can cause problems with your gut and appetite, nausea, and vomiting. So addiction, as I mentioned, these products change your brain. We know that with tobacco, nicotine, 90% of adults who are struggling with addiction started using cigarettes or e-cigarettes before the age of 21, and most before the age of 18. And what you may not know, and I could show you articles that we publish and others, some people think that young people cannot become addicted to e-cigarettes, to nicotine e-cigarettes. They can, and studies clearly show that. Young people are addicted to these products. And the tobacco industry knows this, and the cannabis industry knows this, by the way. And yes, you could become addicted to cannabis. They know it. That's why they're targeting young people. And I'll show you the marketing. They know that if they can addict and attract young people, then they've got you for life. So cannabis in the brain is also important. So yes, addiction, as I said. Cannabis also impairs learning, memory, attention, impulse control, and decision-making. Cannabis is very much associated with lower academic performance, and actually changes in IQ can lower IQ scores. Now, this is not just from one-time use, by the way, or even just a few, it's from continuous use. Sleep issues. A lot of people, adults and teens, think, oh, cannabis will help me fall asleep. It may help you fall asleep, but it is not helping your sleep issues. And it's actually having you take having a drug sleep, and it is not a way to help your sleep issues. And we know the more you use and the higher dose, the highest THC level, the more likely you're going to have these changes. And the brain impairment does not resolve as soon as you stop. These can be permanent changes. Now, we know that youth want to quit, particularly around nicotine. We've seen this. When I mentioned that teens are addicted to e-cigarettes, they know it, they really want to quit, but young people are struggling to quit e-cigarettes. And we have more resources for nicotine cessation than we do for cannabis cessation, but we don't have a lot of resources for anyone for anything. Currently, nicotine replacement therapy, so the patch, for example, it is not authorized or approved by the Food and Drug Administration, the FDA, for the use of anybody under 18. Now, having said that, we certainly know that young people under the 18 are using these products. We're certainly aware of that, but that people under 18, that a physician is prescribing nicotine replacement therapy with some good success, but it is a problem that we don't have a lot of ways for young people to quit. I saw a couple of questions in the chat. Let me just make sure I'm not missing anything. Okay, nothing there. Great. Thank you. All right, so let's talk about lungs. Whether you're talking about tobacco, and to be honest, cannabis too, when you inhale, you can hurt your lungs. I live in California. We have fires all the time. Smoke is smoke is smoke. Anything that you're inhaling can hurt your lungs. Inhaling like tobacco, cannabis, fires. I don't mean asthma medicine or air, but anything else. So these products can inflame and irritate your airway, can destroy your air sacs, really have lung damage. We know that young people who are using e-cigarettes, for example, have had lung collapses, have had exacerbation of asthma, of bronchitis, and so on. And we know that the weaker your immune system is, the more likely you are to have problems with your response to infection. So it's actually, I know some physicians, surgeons, who will not perform surgery on a young person who's using e-cigarettes because they're worried about their ability to heal. We know this with adults, but we're seeing it more with teens as well. So I mentioned flavors, and I'll talk about the number of flavors in a minute, but we also know that the flavors themselves can be harmful to your lungs. So there's something called GRAS by the federal government, generally recognized as safe for oral, but not inhalation. So you can heat butter to hundreds of degrees and eat it. You might burn your tongue, but you're not going to have permanent effects that way. But you could, well, probably not, if it's depending on how hot it is. But the point is that if you heat to several hundred degrees, which is what e-cigarettes are doing 200, 300, 400 degrees, and then you inhale it, the resulting effects can be harmful to your lungs. So diacetyl, for example, a buttery flavor that is in microwavable popcorn, we've seen that harm with microwavable popcorn. It's not that different here. So when you're breathing in that aerosol that's resulting, we see this with diacetyl, we see it with cinnamonaldehyde, which is an aldehyde, by the way, which is cancer causing. We see it with vanillin, which is a vanilla flavoring. We see it with, oddly, T-bone steak, that there are some concerns here. Now, with breathing in, there's also not just harm to yourself, but to those around you. So you may have heard of secondhand smoke, but there's also secondhand aerosol, and this is tobacco or cannabis. And there's also third hand. So what do I mean by this? So the secondhand aerosol, particularly with these cigarettes, the secondhand aerosol has been tested. That's that plume of aerosol. So if you're standing next to somebody who is using an e-cigarette and that plume that comes out can have nicotine, could also have heavy metals, ultrafine particles, cancerous causing chemicals, and volatile organic chemicals. So a lot of concern just about that aerosol that you might be breathing in. Now, what happens to that aerosol? That aerosol that you're breathing in doesn't stay in the air. It has to go somewhere. So it mixes with the chemicals and it comes down into the where you're sitting. It goes on couches. It goes on floors, carpets, drapes, sweaters, anywhere, cushions, and it stays. And in fact, with cigarettes, we've seen that this third-hand effect can stay there for years, if not decades, and the chemicals continue to leach out. There are a number of studies showing that. This is also important for young people to understand. So for you parents, when you're talking to young people, you know, they may not care about their lungs, but they care about their baby sibling, they care about their pets, and so on. So this is important to talk to them and say, you're not just hurting yourself, you're hurting someone else. And in fact, that smoker aerosol can go through walls and vents and pipes and hallways and so on all over the place. And again, not just the aerosol or the smoke, whether it's cannabis or tobacco, not just the secondhand, but that third hand smoke effects, because it has to land somewhere. And I always think of this as a social justice issue, because often people who are lower income, young people, and people of color are more likely to be in more condensed multi-unit housing, and more likely even so to be affected by this second and third hand effects. Now, fentanyl. I'm going to throw in fentanyl for a second, because I know we're mostly talking about cannabis and tobacco, but I have met too many parents who have lost their teens and young adults to fentanyl that I just have to mention this and give a somber moment for just a second. The opioid crisis and the overdose crisis around fentanyl is real. There's about a classroom of kids, about 22 kids who are dying weekly. Now we're seeing rates going down a little bit this year, which is great, but still too many young people are dying. I just want to show you how little fentanyl it takes. And by the way, I give a whole nother talk on fentanyl. I'm not going to go into it much today, but just 2 slides I want to show you. This is the size of a penny. This is a grain of rice. This is the lethal dose of fentanyl. It is smaller than a grain of rice, smaller than a few pinches of salt or a few grains of salt. That little is what we are seeing as the lethal dose that's killing our kids. And what's happening is young people, or people in general, but we're here talking about teens and young adults, are buying pills that are adulterated. These are not kids who are your drug addicts. They're not, or any, even if they are, I don't want to stereotype or stigmatize. They're not people who are seeking opioids or seeking fentanyl. Some are seeking opioids, but in this particular case of the deaths we're seeing from fentanyl, it's young people who are buying adulterated pills. So maybe they're trying to buy a Xanax or a Percocet or some other medication online, and they're not buying it from a reputable pharmacist. They're just buying them online. And what they're getting are fake or fenta pills, we've been calling them, and these are laced with fentanyl. And again, you only need a tiny bit to be deadly. So that's why it's really important. If you don't already, I have Narcan, naloxone, picture on the left, in my backpack. I carry it pretty much everywhere I go. And yes, even through other states, I've had it in my backpack. If I see somebody who's on the ground and unresponsive, the first thing I'm going to do is give them Narcan. It reverses opioids. Fentanyl is a form of opioid in seconds. And if that's not the reason why they've passed out, if it's something else, you're not going to hurt them. There is no harm other than maybe a little bit of a sore throat for a second if you've used Flonase. I have allergies. I use Flonase. It's the same feeling. Please carry this. Let's save a life. And then call 911 immediately as well. All right. Sorry for that somber note, but I would be remiss if I did not have that conversation with you. All right. So let's go talk about why young people are using all drugs, to be honest, but we'll talk predominantly about cannabis and tobacco. There are a lot of reasons why young people use. We're going to talk about just a few of these. Let's talk about flavors. If you want, put in the Q&A how many flavors you think there are in e-cigarettes, nicotine e-cigarettes total. If somebody were to count all the flavors that have ever been out there, how many? So why flavors? Flavors mask the harsh taste and smell of tobacco. If it smells good and tastes good, it must be okay. That's how young people feel. It also masks your ability as parents, your ability to know what's in these products. Again, if it smells good and tastes good, you may not realize that your kid is using. That's one of the biggest questions that we have. Now, I'll show you a few different, if anybody wants to play along, we had one person who put in over 100 flavors. All right, I'm going to speed up because we're getting tight on time. There are over 15,000 flavors. Now, some people say, oh, we need flavors for adults to like these products and not be using other tobacco products or smoking. But these flavors are attracting our kids. Sugar booger, banana butt, unicorn poop, dragon's blood. These are not flavors that we adults want to think about. These are for kids. And targeting youth for cannabis as well. These are, believe it or not, you can have Sour Patch or you can have Stony Patch. And if you're a young person or you're a parent, you may not know about these different products and realize that these are cannabis. Oops. Here are just a few more. So it's really attracting our young people. Easy to hide. If you look at these, you may not realize that a lot of these products are cannabis or nicotine e-cigarettes. This is not by accident. Companies are making these products so that way kids can hide them from you, from parents, from teachers, from healthcare providers, educators, and so on. My favorite is the highlighter. These are real highlighters. They work as highlighters, but they're actually a vaping device. Marketing. Do I need to say more? This is not marketing to adults. This is marketing to our kids. Yes, there are juice box shapes and juice box flavors of e-cigarettes. There are e-cigarettes that look like not only highlighters, but they look like Starbucks. They look like Marvel, all kinds of cute characters. And while the FDA, who has jurisdiction over these products, is sending warning letters, it's not making much difference. Minions, we're seeing Minions out there. We're seeing gloomy bears or gummy bears, and these are both nicotine, and also we're seeing a lot of these with cannabis as well. More Bobo vapes. And then the latest that we've seen, which is really awful to me, are e-cigarettes that are also games and Game Boys and video games that you could play. Access, we're almost done. So really quickly, if anybody wants to put in the chat, what do you think is the age of which you can purchase cannabis and tobacco? Anybody want to play around with that? We have a 21, 21, 18. All right, I'm going to give you the answer in the interest of time. It is 21. So this is important. In December of 2019, it became the law of the land that you have to be 21. Doesn't matter what your state says, it has to be 21 to purchase tobacco. And in states that have legalized cannabis, like your state, it is also 21. It's not surprising. We actually are about to publish a paper show that only about 60% of people of all ages know this. One of the ways you parents can help is to spread the word that it's 21, and we need to have enforcement of this, which we don't very well. Access. So this is a problem. When we see something like this that says local and student discounts, the majority of students are under the legal age of 21. This is attracting our young people, and this is a huge problem. So you parents who care about this, it's a really good point of advocacy to help. Just a slide on misperceptions. A lot of people hopefully you've learned something today. A lot of people, healthcare providers, parents, educators, advocates, policy folks have a lot of misperceptions about e-cigarettes, have a lot of misperception about cannabis. People think it's not addictive. They think that the flavors are good for you. They think it's whatever it is, and that is not the case. So we need to keep getting the word out about these products. Then finally, stress. So the mental health issues right now are real. We are seeing so many young people who are stressed. They're stressed about school. They're still stressed about coming out of the pandemic, still some social issues with young people. Adults are stressed about what's going on in the US, what's going on across the globe. Lots and lots of stress that we're seeing, and the national data are showing it. So we need to help young people cope with stress without using drugs. Teens are reaching out, and that's the fentanyl crisis as well. They're looking for pills. They're looking for tobacco. They're looking for cannabis to self-medicate and feel better. So these are just, and we have a whole set of curriculum just on dealing with stress that's important. And then let's not stigmatize young people who are using drugs or who are having mental health issues. Let's help them, whether it's your own children, whether it's students, patients, whomever. We really need to work with young people and help, because this is a really, really difficult time for a lot of people. So we have a perfect storm to addict young people. We've got stealth and very youth-friendly and youth-focused products. We have very high levels of nicotine and very high levels of THC that's truly addicting our young people. We've got salt-based nicotine that is less throat hit, easier to use. A lot of people don't understand the harms, don't actually recognize these products, and are unaware, so we need to get the words out. There's flavors and packaging that are attracting our young people. I often say to parents, if your kid's room smells like strawberries, bananas, and mango, it might not be fruit salad. It might be that they're using an e-cigarette. They're cheap. I didn't show a slide on this, but these products are less expensive than a pack of cigarettes, but they're harmful. So what can you do? Just really quickly, when you're talking to your young people, don't be hyperbolic. Don't say, oh man, the first time you try this, well, fentanyl, the first time you try, you could die. But that is definitely true. But for some of these other drugs, we need to be honest and give information that's based in science and based in how young people learn and make decisions. But most important is we need to keep them safe. We need to recognize that there's a continuum of use, not for each of your kids, but across this room right now in the Zoom room, across any classroom. You're going to have teens who have never used, and all the way to teens who have tried a few times, to teens who are addicted or dependent. When you go in, you can't just say to teens, never use, it's a bad thing. As much as parents, I'm a parent, I have a 24 and a 28-year-old. My 24-year-old was 16 when Juul came out. Actually 15 when Juul came out. I get it. I wouldn't be happy if my kids were using, but we need to understand that they might be. And if they are, telling them not to use doesn't help them stop using, because they don't want to talk to you anymore. They shut down. We need to have conversations to be able to understand where they are in any given group, or your own kid, where they are. And then if they are struggling, if they're not using, reinforce. That's great. If they are using, let's get them help rather than yell at them. So the idea, you're not going to cause young people to use drugs by talking to them. We need to normalize drug education communication, not normalize drug use. It's a conversation, not a confrontation, and not a lecture. So you're not scheduling, okay, this Saturday at 3 o'clock, we're going to sit down and have a conversation. Let it be organic. I go home if you're, or unless you're home already, but the next time you see your kid and say, I just went to a talk. Can I talk to you about what I learned? I'd love to hear what you know. Let's talk together. Maybe you go on our websites to see some of that information. Don't say things like, you don't use, right? Because your kid's not going to say, no, I do, mom. I do, dad, because that's just going to hurt you and hurt them that they're disappointing you. So we have a whole bunch of resources. Haley, if you want to put that in the chat, I meant to ask you ahead of time. If not, I can put it in the chat. But I have QR codes for those of you who are listening right here for our Reach Lab. You can see right there. I'm not selling you anything. Everything we have that we develop is completely free. The only time we ever charge, one is for our conference, but the other time is if like an entire state wants to use our curriculums and train us, then we might ask for some contract. But for you parents or individual schools or healthcare providers, it's 100% free. We have preventions and resources on there. So just quickly, we have tips to quit smoking, vaping, anything. We have, this is the Zen I mentioned, we have infographics. You're welcome to print these, put them around anywhere. All we ask is that you keep our logos on there because they're completely free for anybody. So just keep our logos on there. We have a lot of information on the fentanyl crisis, how to use Narcan. And then we have lots and lots of free drug education curriculums, QR code there. You can also sign up to be a part of our newsletter and receive information. The one for parents I'd most use is this Healthy Futures. This is your cessation to help young people quit. But any of these curriculums, you will find information to help you have conversations. I won't go through that. So we talk about brain and addiction and stress and coping. Work with your young people. Do some of the stress and coping activities together. We've got elementary, middle, and high school, and we do have Spanish. We also have all kinds of drugs, alcohol, fentanyl, and so on. There's the fentanyl. So, and then this is the self-based, if for those who are using. So ending with follow us on social media. We also push out newsletters, but that's only a few times a year. But if you want to follow us, advocacy opportunities, new research, do. And there's my email, and you can scan that QR code to get any other information. Thank you so much, and I'm happy to take questions as we have time for.
Thank you, Bonnie. Yeah, we'll see if any questions come in. I just love the Stanford Vaping's focus on coping and stress. I think you really hit that piece, and it's so important, right? Kids get the fact-based information and also have all of those tools for coping.
Thank you. Yes, and I'm putting right now in, oh, I can't do it. Can I do it in the chat for everyone? Will it work? Yes, everyone. Here for anybody who wants it, and I'll put my email, my simple email. Same thing, but that's a link to our free website with all kinds of information that you're welcome to go to. All right, I'm seeing some questions. How do we address if they feel like they are actively high? Okay, so I would say the first thing is let them sleep it off. You're not going to be using Healthy Futures cessation or another cessation if they're already high. It's just not going to work. Personally, I am against suspending. We can have a whole debate and conversation on that. You suspend, they're just going to go home and continue to use, and you're not underlying the underlying piece of stress. You're not addressing the underlying issue around stress and coping, which is the biggest thing that we are worried about. So, and their mental health crisis. So if your school does it, they do, but then, let's help them. So I would say, let's try to work with young people, but if they are high at the time, keep them safe, put them in the nurse's office, or if you have as a parent, let them sleep it off. And then after they're done, then you can have that conversation and you could bring resources to them. Haley, I don't know if you agree on that, but that would be my recommendation.
Yes, and we do have our policy in Denver Public Schools is JICHR, and that policy is 0 to 3 day suspension for substance use infractions. So it really can call on, and that's a lot of the work that we do and our team does around alternatives to suspension. So please reach out to us too if we can help with, working with our schools around those alternatives.
Yeah. Yeah, agree. And then the quick question, Dawn's question is wonderful about cessation. It's a really good point, Dawn, and I should have mentioned this. Just like with adults with cigarettes, it can take young people 1 to 11 times, 7 times, I think is the average, to quit. So you really need to support them through the process. We actually have a whole, we have a whole set of information. What's really cool that it was our youth group. We have a large youth group who works with us. They created a lot of the slides and the curriculum to help young people quit. It's not just the physical withdrawal, it's the social withdrawal. You are also not able to go to that party on Saturday night where there might be drugs. You're not able to hang out with your friends. So you've got, as parents, to support them in schools and so on through all that cessation, quitting, getting rid of, knowing that they could be triggered anytime to use. So a lot of times it's just go cold turkey. There's a lot more support that's needed. That's a whole nother talk, but Dawn and others, please look at our website for that information and feel free to reach out to me specifically for more help.
I can also just add a little piece of local context to our 19 school-based health centers. The Denver health centers that are inside 19 of our DPS schools have like cessation products that they can prescribe. So our prescribing physicians are able to do that off-label prescribing for cessation products. And we also have My Life, My Quit locally, which is basically run out of National Jewish, and it's a text to quit line, which also can provide some support for young people as well.
And I should say, in full disclosure, I helped advise and to create that My Life, My Quit, and I love it. And I forgot that you have it, of course, in Denver. Yeah, I came to Denver and helped, but I don't always talk about it depending on the state. But yes, you guys have it. It is fabulous. Use that. The other one is great. Is This Is Quitting, from Truth. So there are lots of programs out there. We're here to help. I know this is difficult to everyone. It is not easy, but there is help.
I know we're at time. Thank you so much, Dr. Bonnie. This has just been such an honor to host you. And for everyone, we are going to send out the recording as well as the slides and all of the resources that, that Dr. Bonnie mentioned. So thank you so much for your time today.
Thank you so much. Thanks, everybody. Hang in there. Take care. Bye.